Fragile X, presented by Grayson Rivers. What is Fragile X? Fragile X syndrome is an X-linked genetic condition caused by an abnormality within the fMRI gene. Fragile X syndrome causes mild to severe intellectual disability and facial abnormalities. It is associated with behavior, social-emotional, and learning difficulties. Fragile X syndrome ranges from minimal impacts on an individual's everyday functioning to significant developmental delays and cognitive deficits, academic problems, social anxiety, behavior challenges, depression, and autism spectrum disorder. The syndrome is prevalent in approximately 1 in 2,000 males and 1 in 4,000 females across the U.S. It affects all races and ethnicities. About 1 in 151 females and 1 in 464 males carry the Fragile X gene. Symptoms of Fragile X. Cognitive impairments present as mild to severe intellectual disability, subtle to severe learning disorders, and delayed development of speech and language. While most children talk eventually, some stay nonverbal throughout their life. Facial abnormalities and physical characteristics present as long face and forehead, large ears, flat feet, and hyperextensible joints, commonly fingers. In addition, facial abnormalities and physical characteristics may not appear until the child begins to age, typically between 5 to 9 years old. Behaviors of Fragile X are associated with autism spectrum disorder. These behaviors are anxiety, poor eye contact, attention deficits, hyperactivity, aggression, temper tantrums, hyper or hyporeactivity to sensory input. For differential diagnosis, it's important to note that Fragile X has 2 core deficits: intellectual function and hyperarousal/anxiety. For autism spectrum disorder, the core deficit is social communication and interaction. Not every child with autism has Fragile X, and not every child with Fragile X has autism. So it's important to note that these core deficits can differentiate between the diagnosis of the 2 disorders. There are coexisting conditions with Fragile X. Medical issues such as sleep problems, seizures, ocular disorders, gastroreflex, ear infections, and toilet training, as well as psychological disorders: autism spectrum disorder, attention deficit hyperactivity disorder, intellectual disability, and specific learning disorder. Autism spectrum disorder is highly comorbid with Fragile X, as well as intellectual disability. Fragile X has a childhood onset and occurs across the lifespan. It is a genetic condition. Individuals cannot grow out of it. Below is a representation of Fragile X across the lifespan, beginning with a male at 2 months of age through 22 years up through adulthood. Note, you can see the presentation of facial abnormalities and physical characteristics as the child ages. Now let's look at gender. Males usually experience Fragile X more severely than females. Males typically have a significant intellectual disability, whereas females have a milder form of intellectual disability. In fact, only 1/3 of females with Fragile X have a significant intellectual disability. Males generally have a moderate to severe presentation of behavior and physical features, whereas females only have a milder presentation of behavior and physical features. The average age of diagnosis for males is between 35 to 37 months, whereas for females, the average age is 42 months. So there's about a 5-month gap between gender. Interesting fact, males have large testes in post-puberty, but comparatively with females, interesting fact, there's a small percentage of females with a full mutation, which I'll explain what a full mutation is in a few slides, have no appearance of the syndrome, cognitive, behavior, or physical. So these females have Fragile X, but you wouldn't know it, and they're generally only identified after another family member has been diagnosed. I thought that was pretty interesting. Note the presentation of the physical characteristics in the boy and the girl, who are relatively the same age. If you look at the boy, you can notice that he has a long face and large ears. If you look at the girl, you can notice that she has a long forehead. This just demonstrates how the characteristics present differently across. Now let's talk about Fragile X from a biological base. Within the fMRI gene, there's a DNA segment called CGG that repeats more than 200 times, which is the abnormality. Well, normally, CGG is only repeated 5 to 40 times. The repetition silences the fMRI gene, which prevents the FMR gene from production of the FMRP, which is a protein that's important for neurodevelopment. Well, this mutation happens and is carried on the X chromosome, which is why Fragile X is referred to as an X-linked condition. Fragile X is manifested in two ways, either through premutation or mutation. If you look at this image, the left is a normal X chromosome, and the right is an X chromosome with Fragile X. If you see where the fragile site is pointed out, this is where the mutations occur of the fMRI gene, either through a premutation or a femutation. So what's a premutation? Glad you asked. A premutation is when the CGG repeats 55 to 200 times. A full mutation is when the CGG repeats 200 and above. Remember, the CGG is a DNA segment. Normally, it only repeats 5 to 40 times. So this process inhibits the production of the FMRP, which is important for neurodevelopment. So this occurs at the fragile site, which is again pointed out on the image. So imagine this. You're playing with Play-Doh and you're making a snake. The more you roll and manipulate its shape, the thinner and more fragile it becomes. But if you choose to make a thicker snake, then you can pass it on to your sister or your brother. Keep that in mind for a moment. In theory, Fragile X is similar to the Play-Doh snake. To truly understand Fragile X syndrome, it's important to understand inheritance and how Fragile X syndrome is passed on and manifested in children. So let's look at this chart. We have father who's not affected by Fragile X, and we have mother who is a carrier of Fragile X. She has one normal X chromosome and one Fragile X chromosome. Mothers with premutation genes can pass on their genes to either son or daughter, whereas fathers with premutation genes can only pass on to their daughters. In addition, mothers have a 50% chance of passing on a normal X chromosome. But here's where things get tricky. Each time a premutation genes are passed on in females, they repeat. Therefore, the larger the mother's premutation gene is, relative to how many CGG repeats, the higher the chance for one of their children to have a full mutation gene. A more concrete example. Say a mom's premutation gene is 160 CGG repeats, and she passes that premutation gene on to her son. Well, then it repeats. Other Fragile X conditions include what's called Fragile X-associated tremor ataxia syndrome, or FXTAS. This is a progressive neurodegenerative disorder that affects primarily older male carriers, which means that it affects males who are premutation carriers. These symptoms include progressive inattention tremors, gait ataxia, and white matter abnormalities, which is generally shown on MRIs. The other condition is called Fragile X-associated primary ovarian insufficiency, or FXPOI. This is a medical condition that affects primarily females who are premutation carriers. Symptoms include ovarian dysfunctions, such as absent or irregular periods, infertility, and early menopause. So as you can see, even as a premutation carrier, Fragile X can still affect the lives of both males and females. How is Fragile X diagnosed? Well, there's prenatal testing and DNA testing. For prenatal testing, there's amniocentesis and chronic villus. Neither are common, considering the risk to unborn babies, and parents are generally aware that they're carriers. Actually, pregnancy is pretty normal, and babies who have Fragile X are born full term. DNA testing is really the only way to 100% diagnose Fragile X, since it's a genetic condition. For this, blood samples are used to determine if the FMR gene is in premutation or full mutation. This type of testing occurs after birth and is completed by a physician or genetic counselor. Although this type of testing is the only 100% way, there's other ways to detect the presence of Fragile X, such as early symptoms, signs, and a comprehensive evaluation, because children still deserve appropriate and accurate support for their development, and Fragile X affects their development. Detecting the presence of Fragile X. Family history of Fragile X syndrome, associated conditions of Fragile X, intellectual learning disabilities, autism, or infertility. Parents typically notice first symptoms in infancy and or toddlerhood, such as delays in speech and language, social and emotional difficulties, or sensitivity to certain sensations. Physical characteristics as the child ages, especially males post-puberty, are also important. And remember the core deficits differentiating the syndrome from autism: intellectual impairment and hyperarousal/anxiety. How is Fragile X assessed? Well, cognitive functioning is measured to look for the presence of an intellectual impairment, strengths and weaknesses across the nonverbal and verbal measure. The Welsher scales and the Leiter 3 are commonly used. Academic skills are assessed: readiness versus achieved skills versus educational planning. The OWLS and the KTA-2 are commonly used. And then also behavior issues. So the presence of hyperarousal and anxiety, comorbidity is assessed. The ABC-2 and the BASC-3 are common measures. Continuing assessment, communication is important to be assessed. A speech-language pathologist evaluation is highly important, as well as a school psychologist involvement. It's important to look at comorbidity versus differential diagnosis, the symptoms that are presented in Fragile X. Common measures are the CLEF-5, the SRS questionnaire, the ADOS-2, considering the overlap between autism and Fragile X, an occupational therapy evaluation to address fine motor and sensory integration, and also adaptive functioning, looking at the individual's skill set. What are their strengths and weaknesses? Two measures are the Vineland-3 and the ABAS-2. And then last, we want to make sure that there's a medical doctor evaluation, a physical exam for some of the medical issues that could coexist, and medication management. how are children or individuals with Fragile X, what are their treatments like? Well, licensed medical professionals could be specialists like a neurologist, a ear, nose, and throat doctor, or a heart doctor, medication for issues such as seizures and sleep problems, or the symptoms manifested like those in autism or ADHD. For IDEA Part C, there's always early intervention, which includes a comprehensive evaluation. Classification may include autism or intellectual disability, speech therapy, occupational therapy, and skills development in cognitive, self-help, and social-emotional areas. And then, of course, we can't forget family support, training, and counseling. And then we have IDEA Part B, the IEP. This includes a range of services, such as physical therapy, behavioral health counseling, speech-language therapy, occupational therapy, applied behavior analysis, intervention plans to support the child academically or behaviorally in their educational placement, inclusion, resource classroom, or self-contained classroom. Really, the child, it depends on their individual needs. These children, alike children with autism, can function wherever their individual needs can be met. It just really depends on their symptom presentation and their level of skills. They can also be served under Section 504 and receive accommodations and modifications. I have a couple listed, such as additional time on work, visual schedules, alternate assignment formats or instruction presentation. And then two very important pieces of treatment for these children is transitioning planning and adulthood. So the focus shifts to the child's social adaptability, likelihood of employment, and ability to find happiness and self-satisfaction in life. For adulthood, agencies like the Department of Disability and Vocational Rehab can help these children find occupation, community involvement, social skills. And what if they want to go to college? I mean, there's the Americans with Disabilities Act, so they can get accommodations and modifications in college. And there's the Think College program. It's great. It allows children with disabilities to go to college and learn academic and occupational skills while getting the college experience. I mean, transition is important for these children. I mean, what happens when they leave the education system? These are things that are important to remember. It's not just for 12 years, from kindergarten to 12th grade that these children need treatment for. So I just wanted to throw that out there. So now let's do a case profile. Jax. So Jax is a 7-year-old male student in the 1st grade. He was diagnosed with Fragile X at age 5. He had a delay in speech and language acquisition, and he currently takes no prescription medications. He lives with his mother and father and 3 siblings, 2 sisters, age 5 and 9, and a brother, age 9. His referral concern is academic skills and school behavior. Cognitively, Jax has a mild intellectual impairment, average visual spatial skills, and long-term memory. He struggles with thinking and reasoning tasks. For academic achievement, Jax has low average reading skills. He's unable to read fluently, but he's strong in simultaneously learning, which means that he works well when learning with someone, or I read and he reads with me kind of thing. He has strong receptive vocabulary, but his average is only 60% on work completion. For social emotional behavior functioning, he learns by imitation. He has poor eye contact. He has hand flapping, difficulty staying seated, and he hums all the time. He makes sounds. For adaptive functioning, he has trouble speaking clearly at times. but he really likes to help others. He doesn't like to interact at community or family events, and his mom has to prompt him for daily functions, although he does complete the daily functions, like bathing, getting ready for bed or school. The first goal for Jax is to improve Jax's behavior in the classroom. The treatment objective is to provide a peer-modeled intervention for appropriate behavior used to gain teacher attention in the classroom that results in decrease in the frequency of Jax's temper tantrums. Given a demonstration and systematically watching peers engage in appropriate behaviors to gain teacher attention 5 times per week, Jax will engage in appropriate behavior to gain teacher attention in the classroom. Examples include raising hands quietly and asking for assistance. In addition, for treatment objectives, when engaged in appropriate behavior, the teacher will provide positive or verbal praise for Jax once every 3 minutes. For baseline measurement, based on observations conducted in the classroom, Jax engages in temper tantrums to gain teacher attention. Jax's temper tantrums were followed by teacher attention for 20% of the observation. Jax's temper tantrums were followed by peer attention for 5% of the observation. To monitor progress, the teacher will use a tally system, marking a tally to indicate each instance Jax engages in a temper tantrum. Training will be provided twice a week for 2 weeks, along with observations at the beginning of the session. This will include a step-by-step instruction and modeling of the intervention. This will be for the teacher and peers to make sure that they know how to implement the intervention. And following the training, progress will be monitored weekly, in addition to check-ins for treatment integrity. If the teacher is observed to deliver attention following a temper tantrum with less than 80% integrity, performance feedback will be used to improve the implementation. The second goal for Jax is to increase his social skills. The treatment objective is to provide a socially based intervention delivered in a natural setting for social interaction and communication skills that results in increasing Jax's social skills to developmental level. By targeting basic social responses, such as eye contact, name response and greetings, and complex skills, initiating or maintaining conversation, through individualized instruction and guided practice 3 times per week, Jax will have increased his social skills by learning steps to appropriate interaction with peers, adults, and other individuals. For baseline measurement, based on observations conducted in the classroom, Jax has poor eye contact, trouble speaking clearly, and struggles with social cues. Jax often works and plays alone, although in direct interview, he indicated that he would like friends because he likes to help others. To monitor this progress, the teacher will record data during each of Jax's sessions using a tally mark system. The teacher will mark one of the following: correct, incorrect, or no response. Training will also be provided for twice a week for 2 weeks, along with observations at the beginning of the sessions. This will also include a step-by-step instruction and modeling for the intervention. Progress will be monitored weekly, in addition to check-ins for treatment integrity. If the teacher is observed to deliver the intervention with less than 80% integrity, performance feedback will be used to improve implementation. The last treatment goal for Jax is to improve his reading skills and support his learning environment. The treatment objective is to provide a drill and practice intervention for reading fluency skills that result in improving Jax's reading skills to grade level. Given a first grade DIBELS oral reading fluency probe 3 times per week, Jax will read 69 words correct per minute by the end of first grade. In addition, his other treatment objective is to provide Jax with visual schedules and supports to help with learning and transitions in the classroom. For baseline measurement, results of direct assessment indicate that Jax's reading skills are at a first grade instructional level and that he lacks basic fluency skills. Given a first grade passage, Jax is only able to read 30 words correct during a 1-minute probe. In addition, based on an observation conducted in the classroom, Jax currently does not have any supports in the classroom. For progress monitoring, his progress will be monitored weekly using doubles probes from each session. Probes will be scored, and the median score will be used to determine his progress. Time for a quiz. Symptoms in females are generally less severe than in males. This is best explained by which of the following statements? A. Gender differences in presentation of features. B. Males have 2 X chromosomes, whereas females have 1 X chromosome. C. Males have 1 X chromosome, whereas females have 2 X chromosomes. Or D. Fragile X is an X-linked condition. The correct answer is C. Using symptomology, how could a student with Fragile X syndrome be differentiated from a student with autism spectrum disorder? A. Intellectual impairment. B. Social communication and interaction. C. Attention deficits. Or D. Restrictive and repetitive behaviors. The correct answer is B. Who should diagnose Fragile X syndrome? A. School psychologist. B. A clinician. C. Neither A or B. Or D. A physician. The correct answer is D. Individuals with pre-mutations are only carriers. This statement is most consistent with which of the following? A. Pre-mutations mean the individual also has Fragile X. B. Fathers have a 50% chance of passing a mutated gene to their son. C. Mothers have a 50% chance of passing a mutated gene to their son. Or D. All children born from carriers will have Fragile X. The correct answer is C. Zara was diagnosed with Fragile X syndrome at 2.5 years and has only received medication from her pediatrician. Zara is now 5 years, 2 months old and in kindergarten. Since she has a medical diagnosis, Zara's mother has asked for special education services. Which statement is true regarding special education services and medical diagnosis? A. All special education services require medical diagnosis and impact on educational performance. B. Medical diagnosis do not guarantee special education services. C. Medical diagnosis guarantees special education services. D. Children are required to take medication if they have a medical diagnosis and receive special education services. The correct answer is B. A couple resources for Fragile X include A. A fact sheet about Fragile X. B. The National Fragile X Foundation. This website has a variety of resources, including tools categorized by age group. And C. Fraxia, an up-to-date website about research, assessment, and treatment information, including real stories about children with Fragile X. More resources also include D. A family support website with real-life experiences, and F. A website filled with educational support for teachers and school personnel. For example, you can click on an area like inattention, and it gives you tips and tools for helping manage the child's inattention. And references slide. Well, thanks guys for listening. I hope you enjoyed it. And yeah, thanks.